group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Thank you for tuning in today. This is Scrubbing Up with Dr. Michael Kachmar, and I'm here actually by myself today. And we have this medical program that we do we try to do it every week, and I'm here today, and I'm trying to work all the cameras and everything by myself. So hopefully we won't have any issues. And we have 3 topics we want to talk about today. But I just want to let you know about myself. My name is Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. I work in Toms River, New Jersey, and Ocean and Monmouth County. And I've been practicing for, 30 years. And again, I do surgery in the hospitals. I have office practice. And we've been doing this program for, about 3 years now. We haven't done a Scrubbing Up show for several months. I fractured my shoulder, so actually having a plate taken out next week or this week. So anyway, we'll go to our whiteboard. I love my whiteboard, and we're going to talk about a couple topics today. We're going to have a quick show. I'm not going to spend a lot of time, but we have on the whiteboard here. We have one thing we're going to talk about is edibles, overdoses in kids. This is becoming a national problem. Children are getting into these marijuana edibles, and they're overdosing. I don't know how many of them are dying, but there's quite a few hospitalization. It might be up at like 3,000 so far. The other thing we're going to talk about briefly is gender-affirming surgery. There's some new things, a new article that came out here I'd like you guys to know about. And then the other thing is the ketamine. This is, you may know it from the news, this is what they say contributed to the death of Matthew Perry. So we're going to talk about those things today. So I think what we're going to do, the first thing we're going to do is go into this article with regard to gender-affirming treatment. So I just want to make you understand, give you a little basic understanding here. So you have what's called gender dysphoria. That's the diagnosis of somebody who has issues with their body type and gender. Not going to get into it. You could look it up. That's just for terminology. So you have gender dysphoria, and then what you do for that is gender-affirming treatment. That could be psychological counseling, that could be medication, and it could be surgery. And so those are the things that we're going to talk a little bit about the surgery right now. This is an article that came out a while ago, but I thought it's an interesting article, and I wanted to bring it up. So this is Boston Children's Hospital director calls for drastic increases in capacity for gender surgeries for minors. And I think we could say minors is anybody under 18. And if you look here in this article, what we're talking about here is, and this is a plastic surgeon who's talking about gender-affirming surgeries. And that's where you remove breasts or you take the penis off and you try to make a vagina. And there's a lot more to it. There's about 15 procedures that are actually approved in New Jersey. One of the insurance companies, United Healthcare, I was looking at their webpage, and they have about 15 procedures that they approve and they'll pay for with the diagnosis. And but this article is interesting because what they're talking about here is they feel that due to the states that are banning this, there's a lot of states that are banning this or trying to ban it or reduce it. The Boston hospitals thinking that they're going to get people coming up to see them, and so they want to build up the capacity so they can handle these. This is an interesting thing because gender-affirming treatment is not only being battled in the politics in different states, but it's in the medical field. I mean, it's crazy right now how many people you got. One group of people are on one side and another group on the other. So the medical profession is really having a lot of issues with this. And I just want to show you one thing here. And you could read this article. You could get it yourself. But was interesting that the military here, there was one here. And this is another article that you might want to go into. It says the Pentagon doctors claim 70-year-olds can make decisions to be injected with hormones and puberty suppressants. So there's a big argument now. Can children make their own decisions? Should the parents have anything to say in the matter? It's interesting. Say the parents want the child to have gender-affirming treatment, and the child doesn't, or if the child wants it and the parents don't want it. Same thing with abortion. In New Jersey, a child at 12, 13 years old could have an abortion, and they don't need the parents' consent. But I asked the other question: what if the child is pregnant and they don't want an abortion? They're 12, 13 years old, and the parent wants them to get an abortion. So it's kind of a crazy thing. But with gender-affirming treatment, there's a battle going on, and it's multi-layered. But I just wanted to throw this out. This is a great article. You guys should read this, because I think Boston Children's Hospital has been one of the premier centers for this surgery. I'm going to do a whole show. I did a show already on gender-affirming treatment. I'm not going to get into it much more here, but I just wanted to throw this article out here. It's a battle. People are still pushing for it. I believe the new head of the AMA is a strong proponent for young people getting the treatment as early as possible. So that's a big battle going on in this country. So I just want to give you a heads up on that. So that's one thing we wanted to talk about. You guys could do a little more research on this. The other thing I want to go to is let me get out of here real quick. Like I said, I apologize. I'm doing everything myself here. So that was the Boston thing. The other thing I want to talk about is this edible thing. This is becoming more and more of an issue. And, edibles are, I don't know if you don't know what edibles are, but edibles are these things you buy in the store, and they have marijuana in there. And some of the stuff, I guess, on the street could be laced with fentanyl. But so they look like gummies. They look like candy. And what's happening, and here's an article here, and this was December 12th. So this is very recent. Florida middle school students hospitalized after taking edibles, suspected drug overdose. And I just want to let people know that, your kids go to another house for a play date. I don't think the parents there are going to give these kids edibles, but if it's laying around, the kids think it's candy. They could get, take it and get really sick. And these are handed out in schools. It's becoming a real problem. I don't know how many students or people have died from the edibles. I'm just trying to go through here. But I think this is an interesting article. You guys could look at this here, and you could read about it. But I think this is happening more and more often, where kids are getting into these pills and these edibles, and they're getting really sick. I think there was about 3,000 of them last year. So that was an article I thought was really interesting, and I wanted you guys to look at it. I would, you could do more research on it, but you got to be really careful what's going on with these kids. And the last one is something that was in the news a while back, and it was in October, and it was pertaining to Matthew Perry, one of the actors on Friends. Great actor. That was a great series. I didn't watch it that much, but there's reruns. And what he died from, they just came out with his autopsy not too long ago. So I want to talk about a little bit about that, because this is in my wheelhouse. These are drugs that we use as doctors. So here it is here. So what is ketamine, the drug that killed Matthew Perry on October 28th? And this is out of the magazine Health. And so, what is ketamine? And so, let's just look at what they say about his death here. And I just want to put my glasses on here. So the examiner. So this was nearly 7 weeks after Matthew Perry apparently drowned in a hot tub at his California home. The Los Angeles County Department of Medical Examiner released the actor's cause of death as acute effects of ketamine. Secondary conditions contributing to the death were listed as drowning, coronary artery disease, and butyramine, as the autopsy reported. That's another drug. I think they give that for if you're using narcotics. The underlying coronary artery disease made the effect of ketamine on the heart more pronounced. So it's interesting. So it was the autopsy report confirmed that Perry had received a ketamine infusion therapy and a week and a half weeks prior to his death, reportedly as treatment for depression and anxiety. So what that means, infusion, is they put an IV in your arm and they put the medicine through. It's an infusion. It takes time to deliver that medication, and it's used medically for depression and anxiety. It's also used for pain syndrome. He also had prescription medications and loose pills were found at the 54-year-old actor's residence at the time of his death. So what is ketamine? This is what I wanted the guys to know. Its intended use as an anesthetic to be handled by medical doctors and veterinarians. Ketamine is also used illegally as a recreational drug. The Alcohol and Drug Foundation describes ketamine as a dissociative drug, which means it causes people to feel separated and detached from their bodies or physical surroundings. And so that's what it is. And so the off-label use of ketamine has skyrocketed, according to this article, in recent years, despite limited data supporting the safety and efficacy of the practice, according to the report from Yale School of Medicine. And it's here's the funny thing about it. It's colorless, odorless liquid. It can be white or off-white powder. When used in a powder or liquid form, it is often mixed with beverages or smoked with marijuana or tobacco. So depression. Here's the ketamine for depression. In 2019, the Food and Drug Administration approved ketamine in a nasal spray format for treatment-resistant depression and suicidal intent. It is intended to be used in combination with antidepressant pills only under the supervision of medical professionals. And it says here it's regulated tightly. And so it says here ketamine is more commonly used for treatment of severe depression and to break the cycle of depression, as well as pain management. Pain management, I've seen that. I know some pain management facilities that use this drug very successfully, by the way. Common cause of overdose. So common causes of overdose death, including excess sedation, respiratory failure, low blood pressure, cardiac arrhythmia, coma, and seizures. So it says in Perry's case, he was already getting it intravenously, but it has a relatively short half-life, so he must have taken some soon before the pool accident the doctor surmised. So it sounds like it was an accidental, thing. And here's why does ketamine become so deadly? And it affects the heart, just like a lot of these things, respiratory and neurologic functions, and can be fatal. And so it's one of those kind of things where, Michael Jackson's interesting. Michael Jackson's death. I remember when Michael Jackson died. He let me get out of this here. He was getting infusions of a medication that's given during anesthesia, propofol, and it was given by a doctor, and he died. I don't think he wanted to die either, but these are very powerful drugs, and they're given by doctors. And then I think what happens is some of the patients start thinking, medicating themselves, taking more of it. I think that some is, a little bit is good, more is better. And they wind up dying. It's tragic. And I just want to caution everybody out there. This is, we got a lot more medications out there, a lot of drugs floating around. And I tell the young kids that I talk to, don't take anything now. You don't know. One little pill, one little tiny pill, the size of an aspirin, could kill you. Could kill you real quick. What happens is just you stop breathing. We see it all the time. I'm going to do a show soon on the amount of drug overdoses in the United States. Right now, it's approaching 120,000 drug deaths in this year in the United States. When right around when Barack Obama got in, I think the drug overdoses were maybe in the 30,000, 40,000. It started climbing. A lot had to do with the open borders. It was coming from China. Fentanyl mostly fentanyl is a synthetic opioid. It's about 100 times more powerful than morphine, which is grown with plants. But this is made in China. It comes over to Mexico and then comes up. So it started to climb during the Barack Obama years, maybe got it to 60,000, 70,000. Then when Trump got in, he kind of closed the border and actually went after China with regard to the fentanyl and started going down. But when Biden got in the open border, it just skyrocketed. Now it's just ridiculous. And it's not just fentanyl. There's other there's other drugs. There's a very powerful animal tranquilizer. I think it's called xylazine, and that's mixed with the fentanyl. It's interesting. They just came out with a thing about George Floyd. I think it was a documentary, I think, called "Falling in Minneapolis." Anyway, but George Floyd was under the influence of what was called a speedball. So he had fentanyl in his system at the time. I think he had COVID also, and he had another drug. I think it was crystal meth. Anyway, a lot of people mix and match these drugs, and you get sick. It could end your life a lot quicker than you want to. So overdose drugs in this country is out of control. We're going to do a show on that, about 120,000. So it's pretty sad. Anyway, I just wanted to say hello to you guys. This is the first show that I've done. We don't have Jeremy here today. I'm going to try to get him here the next visit. But I just wanted to, say hello and make sure that, we're still here. If you guys want to reach us, we're here at Jersey Shore Foot and Leg Center. You could go to our webpage. It's called Jersey Shore Foot and Leg Center, and it's up on the screen right now. And if you want to get a hold of us, I have you could give us a call or come on to our email, and the email is drkachmar@icloud.com. That's drkachmar@icloud.com. It's pretty easy to get a hold of me, and you guys could what do you call it? Leave a message, and we'll get back to you. Anyway, I thank you. I appreciate you listening, and I would I would love you to encourage you to subscribe and give us a comment and like us. We're on also Spotify and Apple Podcast, Twitch, Twitter, YouTube, and Facebook. Anyway, thank you very much. Appreciate you tuning in, and we'll see you next time. Bye-bye.